Hello class, my name is Tricia Miller and today I'm going to teach you how to do an assessment of the general appearance and the head. So the first thing that a nurse should do is greet the patient and explain what they're doing. So, hello Brooklyn, I'm Tricia. You're here for your normal checkup? Yeah. Okay. There are many things that you can just assess by looking at the patient without ever touching them. Just by talking and asking the history questions, you can tell if she's alert and oriented. Look at her skin color. Is it normal for her race? No open wounds that you can see. Does she look, is her nutritional status good? Does she look well nourished? Or is she too thin or overweight? Is her hygiene good? Is she clean? And then when you're talking to her, you can see if her speech is clear and if she can hear. When the patient is up moving around, also you can see her gait and see if it's normal or if she has to use a cane or a walker or have some assistance. And another thing would just be if there are any obvious deformities of her body. And all this information came from Jarvis, our book, but actually the video assessment 2020, of course. And then when looking at her head, you're going to look and see if all the parts of her head and face are symmetrical. If her eyes and eyebrows and both sides of her nose and mouth are symmetrical. And then you're going to move on to palpating the skull for any bumps, indentations, or pain. So I'm going to feel your skull for any bumps, give you a little massage. Any pain there when I do that? I don't feel any abnormalities. And then I'm going to also press on her sinuses, gently of course. The maxillary sinuses, you feel any pain there? Or the frontal sinuses, any pain there? And then I'm going to put my hand on her temporomandibular joint and ask her to open her mouth. Okay, do you feel anything when you do that? And I don't feel anything abnormal there. You should also look at her hair, see if it's attached or firmly attached or if it's falling out easily. And all of this also came from the Jarvis video assessment. Normal findings of the head would be that her facial features are symmetrical. There are no bumps, indentations, or painful areas on the skull. Her hair is firmly intact to the scalp, and there are no pain in the sinuses or in the temporomandibular joint. Her general appearance, the normal findings for general appearance are that she has normal skin color, she's clean, she looks well nourished, and her speech and hearing are within normal limits, and she can walk without assistance. Some abnormal findings of the head would be if she would have drooping of one side of the face. This could be a sign of stroke or Bell's palsy. Asymmetry of the face shows that the cranial nerve number 7 is affected. And this was found in Inderua 2019, page 494. And that is all.